Hello, everybody, and welcome to the University of Queensland's Faculty of Health and Behavioural Sciences Alumni Webinar Series. My name is Paul Purcell, and today we'll be joined by Associate Professor Rynne and Gloria Choi from the UQ School of Human Movement and Nutrition Sciences. Today, the two of them will focus on the emerging research and the uncharted waters that we all find ourselves in light of the COVID-19 pandemic, and specifically how it relates to sports coaching. I begin today by acknowledging the traditional owners and their custodianship of the various different lands on which we all meet. On behalf of the university, I pay our respects to their ancestors and their descendants who continue cultural and spiritual connections to country. We recognise their valuable contributions to Australian and global society. For those of you joining us live today, you're encouraged to ask questions throughout the webinar using the Q&A function, which you can find at the bottom of your screen. At the end of the presentation, Stephen and Gloria will attempt to answer some of your questions, so feel free to ask them as the webinar goes on. Additionally, this webinar is being recorded and will become accessible via the HaBS Alumni webpage early next week. I will also send out an email with the link to this to anyone who's registered, and feel free to share this with your colleagues and networks. And now, it gives me great pleasure to introduce firstly, Associate Professor Rynne.
Hello, thank you for the introduction, Paul. And I'd like to re-emphasise the acknowledgement just offered by Paul. I'm on unceded lands here in Brisbane, or Meanjin for the local Yuggera and Turrbal people. And I acknowledge their elders and point out the tremendous contribution that Aboriginal people have made and continue to make in sport. So by way of a very brief introduction, I'm a former phys ed teacher and I've got a background in human movement studies. I've been a coach for about 20 years, a little bit more than 20 years actually, with a special interest in track cycling. But currently, in addition to coaching, I'm an academic. So I work here at the University of Queensland in the area of sports coaching. I've got a particular focus on learning. I'm program convener for our postgraduate programs here in the School of Human Movement Nutrition Sciences, where we offer a graduate certificate and a master's degree in sports coaching offered entirely online. And for the purposes of today, I'm also fortunate to be the former supervisor for my current co-presenter today, recent graduate, Gloria Choi. Over to you, Gloria.
Thank you, Stephen. Yeah, a bit of background about myself. As Stephen mentioned, I studied a Bachelor of Sport, Exercise and Sport Science. Recently graduated this past semester and entering the job market. Yeah, and in terms of the academic side of things, I've had the privilege of doing my honours project with Stephen this past semester, specifically in the area of elite sport coaching and COVID-19. In terms of coaching myself, I've been involved with coaching volleyball for the past 4 years. So that's been a good avenue where I can apply bits of my degree and just, yeah, pursue a passion, pursue a sport I've been passionate in for quite a long time. And yeah, over the course of my degree, I've developed a special interest in sport coaching, strength and conditioning, but also clinical measurement sciences.
Excellent. So in setting the scene for today, I think all of us can appreciate it's been a very challenging year, and sport has been a really visible example of that. Now, Professor John Carney, head of school here at Human Movement Nutrition Sciences, has actually done a previous HaBS alumni webinar presentation back in July, where he talked about the broad challenges that sports face. So I'd encourage you to go and look that up. Paul will put that in the link in the chat. And also there'll be some further information that'll come out with ours as well. But in this session, we're going to really look far more specifically at elite sport. And we're going to be considering the research evidence that has started to emerge. And as part of this, we've actually got a healthy skepticism about published research during this time. So within the research community, typically it takes quite a while to generate data, work through it, and then engage in the publication process. So we have a healthy skepticism about any research that's able to get out as fast as some of this COVID research has. But we're really keen to see what empirical bases there might be out there. In terms of elite sport coaching and trying to characterize that for those of you who may or may not be that familiar with it, coaches assume a really central role to their athletes' development and performance. And they can have really positive, maybe neutral, and sometimes negative impacts on the athletes and teams that they work with. Now, the role description of an elite coach extends beyond just that face-to-face stuff, the direct intervention stuff that we're all so familiar with in coaching. the coach often assumes this crucial role in the holistic development of an athlete, managing a variety of different constraints, providing logistical and technical support, as well as empowering their athletes towards achieving the varied goals that they might have. Now, in elite sport coaching and in the research, we actually characterize what coaches do as being quite muddy and hugely chaotic in terms of their endeavor. Coaches are constantly planning and monitoring and reacting and evaluating changes to their athletes, the surrounding environments throughout preseason, in-season and off-seasons. So it's a complicated and often poorly understood job at the best of times, without the added complexities of a global pandemic. But when you throw that into the mix, COVID-19 has really quite greatly impacted sports worldwide. And the most visible way that has been in relation to the suspension of major championships and competitions, and particularly something that's a highly visible and a really prominent event, the 2020 Tokyo Olympics and Paralympic Games have been postponed. So elite athletes and coaches have had to modify their short and long-term training and competition plans to work around these seemingly ever-changing pandemic restrictions. They've had limited and suboptimal training conditions, and of course, the restrictions to do with travel. Athletes have had to undertake training at home with modified exercise programs and equipment to keep in line with quarantine and social distancing measures. And coaches have had to adopt this far more hands-off approach, coaching sessions that might take place via conferences like this or via calls. And coaches have also been required to collaborate with medical professionals when taking on advice and allowing athletes with COVID-19 who have been infected and recovered to return to sport safely. So we here at UQ and a variety of others around the world have spent a long time advocating for and actively contributing to the empirical bases for coaches' practice. However, there's been really limited research, guidelines and recommendations that have been developed for coaching in the COVID-19 climate. So the purpose of the project that we're going to talk you through today was to really investigate the emerging empirical research regarding the effect of COVID-19 on elite sport coaching, and specifically in relation to its effect on mental health, injury, and return to sport. So the practical guidelines and recommendations have been developed from these findings to help us better guide elite sport coaches on what might be the best practices for coaching during a global pandemic.
And to give you a quick overview of the project and sort of what it consisted of, we decided the project would take the form of a qualitative systematic review. So in short, this allowed us to comprehensively consolidate all research on this topic of elite sport coaching in COVID. And so I decided to use 4 databases, as you can see on screen: PubMed, Sport Discus, Cochrane, and PsycInfo, to look at all the data and all the literature out there up and including the 15th of September this year. And so a combination of the keywords that you see on screen were used, and that made up the bulk of the search process, along with some pre-made COVID PubMed searches as well. And so we decided the inclusion population would be elite or professional athletes, and the sport coaches also involved at these competition levels. And for the purpose of this project, the elite athletes were defined as athletes competing at or above the national level of their respective sports. And the terms elite and professional were used interchangeably. And so, articles with and research with original data, various commentaries and editorials, and just publications with recommendations were included, and that made up the bulk of the literature that was included. And so to outline the results in the analysis portion of the project, we found 26 articles that were included in the final review from a total of 4,116 initial references. So throughout the research process, and especially with such a new pandemic and a pandemic that's evolving, really didn't expect to have so many initial references, let alone having 26 articles to include in the final review. But that being said, it was quite the interesting journey, analysing all these sources and synthesising all the data. And so, as you can see on screen there, I eventually split and identified 3 major themes from the sources, with them being a multidisciplinary approach, coaching and well-being. And the sources that were then analysed a second time to sort of further split up these larger themes into sub-themes, as you can see in the 3rd row on screen as well. And yeah, in terms of synthesizing all the data and looking at what it means, we identified sort of 2 main areas that we would look at. The first one being impact on the elite athlete, and the second one being impact on the elite sport coach, which Stephen will touch on a little bit later. But the first main impact that we found was that there's a significant physical and psychological impact on the athlete. Athletes were found to be under high emotional and psychological distress from not only a different lifestyle that they were forced to, I guess, live in for the next however long they would be in quarantine for, but also just the fluctuating COVID-19 situation and the varying restrictions as well. And so athletes were encouraged to seek psychological support and counselling, especially as they were forced to transition from such an active and structured training regime with unrestricted access to equipment and coaches and the teammates and training partners, to suddenly transitioning to being quarantined in their homes with limited support, resources and guidance. And psychologically, it was also found that the abrupt transition might have exacerbated existing psychological distress or disorders in relation to the athlete's career. Or with newer athletes, this may cause new psychological distress due to uncertainty regarding their career or just dissatisfaction in terms of their performance. And so, it was highlighted that psychological support needs to be provided for athletes. And on the flip side of that, athletes should also be encouraged to seek out psychological support and counselling for them to be better able to manage any emotional or psychological distress. And on sort of a more physical side of things, athletes also need to accept that detraining will occur with a decrease in intensity and a decrease in volume. It's almost impossible to, predict the magnitude to which this will occur. But it's also vital to manage the expectations of athletes during this quarantine period, and also encourage them to adjust to any new personal or sporting schedules. And one way to help them do this is for them to engage in goal setting. So goal setting was identified to be a pretty effective method for athletes to cope with the pandemic events and for them to revise the future plans for both training and competition. And it also serves as a method to help athletes to prioritise and guide practices or steps to achieving the goals themselves. And as I'm sure you've all heard to some degree before, short and long-term goals. So this was an effective recommendation for them to consider, setting both short-term goals, looking at quarantine training goals and modifications in that initial quarantine period, but also setting further long-term goals, looking at the resumption of sport and to look at any new opportunities that may arise or any new goals that they want to set. And looking at that resumption of sport period, it's also recommended for them to adopt a prolonged retraining period. So however long the detraining period was, it's recommended that the retraining period is to be a similar length or if not longer to accommodate for any decreases in performance. And another benefit arising out of this quarantine period is the opportunity for athletes to be able to adopt new training methods or styles that they might not be able to implement or trial during a normal season. So despite a loss in performance, athletes are encouraged to use this opportunity to use new training styles, adopt new training methods, and this might be both physically and psychologically beneficial to the athlete, as it just varies it up and limits the monotony of a training environment or the exercises involved.
And then, so not surprisingly, because a lot of the focus for these papers was on athletes, a lot of the coach recommendations or impacts connected really closely with that. So the first was about multidisciplinarity of work. So one of the key impacts was related to the greater emphasis of coaches needing to work with others. And in this case, specifically medical professionals, many of whom they haven't really had to work with before. So very rarely have coaches had to work with local and national governments in this area, public health authorities, and event organisers. The second part was about, second impact was about detraining and how it must be assessed. So coaches have to consider the length of the detraining period, as well as the level of fitness that the athletes have been able to maintain. And they've recommended that, or the impact is that coaches should actually adopt a rehabilitation approach to the strength and conditioning of their athletes, which would allow them to better assess the physical condition, as well as implement training programs to develop fitness parameters like strength and power and hypertrophy and endurance. Associated with this was careful physiological planning, as well as, in brackets there, mental health. So consideration has to be given to the length of the preparatory conditioning phase and the intensity of the training sessions upon resumption of sport. So what they're trying to really do is to avoid training spikes. Coaches have to then also ensure that their athletes' mental health remains central. But interestingly, in the research, there was less of this. There was less of this mentioned in the research, but there have been plenty of practical examples that we've come across in sport of how coaches have been working in this area. Another impact was the need to explore new and creative methods of training. So in limiting and countering the effects of detraining, coaches of elite athletes were encouraged to explore new and creative methods in programming training sessions. And I think if you come think about your own sports, there'd be plenty of examples of how people have been creative in doing that. And like with the athletes, coaches are varying components of exercise that are programmed. So varying duration and frequency and type of training that will help with staving off detraining effects, but also will keep the athletes engaged and motivated. In the middle section there, one of the impacts was to learn from past errors. And although we keep talking about these being unprecedented times, there are some previous experiences like the 2011 NFL lockout that coaches can learn from and have learned from. So it's such an uncommon situation that athletes were actually poorly prepared to return to sport, and there was an unprecedented number of Achilles tendon ruptures in the NFL during that time. So we can learn from that. The second last was about striking a balance. And this was in order to maintain an optimal management of elite athletes, especially those who have been infected with COVID-19, coaches and medical professionals must strike this ethical and operational balance between optimizing the performance outcomes and athlete health management. And those involved in elite sport have actually had to take the athletes' beliefs and circumstances and opinions into consideration, because sometimes they differed quite widely from the opinions held by medical and sports medicine professionals. And then finally, coaches, one of the impacts was they had to broaden their skill set, and particularly to do with interpersonal skills, as they adopted more of a supporting role for their athletes during that COVID-19 pandemic. And I certainly question that's a big ask for coaches who are already required to do so much.
So to help translate the theoretical findings of this review to practice, we've sort of come together and put together some guidelines and recommendations to better aid coaches on how to facilitate and help the athletes and coach the athletes during the COVID pandemic. And so the first area that we've looked at is a multidisciplinary approach to athlete care. And so it's important for coaches and the coaching team to liaise and discuss with various local and national governing authorities, public health authorities, sporting organisations, and even within the athlete team personnel as well. And I'm sure, as all of you are familiar with, implementing various infection control measures. So even simply just as exit and entry points, social distancing signage, having hand sanitizing stations, and also disinfecting supplies provided. And also there's a suggestion to include an extensive multidisciplinary team. So this might involve doctors, physiotherapists, sports medicine physicians, exercise physiologists on top of your usual coaching team. And I guess a more recent and relevant example of how sort of these first three implications work out is the Australian Open coming up. Not sure if many of you have heard the restrictions or sort of the practices in place, but yeah, there's various restrictions for players, coaches, and the coaching teams, with a mandatory 14-day quarantine, and players being limited up to, I think, 5 hours of training per day, with only one training partner. And to throw that into the mix, there's also the need for regular testing and all of that. So I think there's a lot more barriers to conducting sport now, but I think in the same sense, everyone is on a level playing field if everyone has to go through, I think, all the same infection control measures and testing procedures and all of that. And so for more severe or extensive cases, there's a recommendation for a comprehensive cardiac and respiratory evaluation as per medical opinion. So this might include blood tests and ambulatory monitoring, like ECGs and Holter monitors for the heart, and even as extensive as a cardiac MRI or chest X-ray, to ultimately put the athlete's health as a priority, but also to be able to manage the COVID-19 infection as well as possible. For athletes that are symptomatic and COVID positive, there's the recommendation to immediately cease all forms of physical activity for at least 14 days until the resolution of all their symptoms, as well as the absence of fever. And for athletes that may not be COVID positive and are asymptomatic, testing is still highly recommended if community transmission is high. And also there's the recommendation for medical professionals to adopt a more symptom-oriented approach.
So in terms of practical implications related to programming, although I mentioned earlier on, and Gloria alluded to it as well, the high level of mental health concern and consideration around athletes, that wasn't typically included into the programming area. So lots of the programming was to do with detraining, injury, and return to sport in terms of biophysical foundations. So you can see in the list there, anticipating detraining and working that into your programming, considering and being informed about the athlete living conditions. So what are the practical considerations to do with where the athlete's going to be training? They talk about using easy to use measures of intensity like heart rate or a rating of perceived exertion. So going really old school in a few of those, particularly because athletes are doing a lot of self-directed training. Resistance training, limits around 2 to 3 times a week, no longer than 60 minutes a session. And that should be enough just to hold. So you're not looking to build, but maybe to stave off detraining. Aerobic exercise, 3 to 4 sessions a week, no longer than 60 minutes. Anaerobic exercise, high intensity periods, about 80% of maximal aerobic speed if necessary, but interspersed. And they're all to do with just trying to maintain in this period. And then finally, the return to sport is really about a progressive, stepwise foundational model to get out of quarantine and out of some of those situations where detraining's occurred and back into formal competition.
And in terms of the athlete well-being and the psychological side of things, there's a recommendation to provide psychological support, and this might take the form of well-being coaches, psychologists, and psychiatrists. But there's also the importance to guide athletes to focus on new opportunities that might arise out of this quarantine period. So maybe like new forms and modes of training, or a shorter off-season period for the athlete to be able to reset, not only physically, but psychologically as well. And as we sort of mentioned before, the implementation of short and long-term goal setting is also important, being able to focus on the initial and immediate quarantine period, but also a longer-term goal to look at training sessions and competitions when sport ultimately resumes. But I guess the interesting thing to note, as Stephen's also touched on before, is that, these implications are definitely helpful, and there's a lot of practical side of things, but it all seems a bit theoretical at this stage. There's definitely opportunities for more research to be conducted. And the body of research is far from complete, especially with an evolving pandemic. So there are plenty of avenues for future work. An example of this that was found more recently was that Exercise and Sport Science Australia, ESSA, published a review on simply returning to sport and returning to training with masks and looking at the effect of masks and different types of masks on heart rate and training and stress on the body during training. So that's definitely an avenue for future research and future work as well.
And that example is a great one because it talks about the intersections between research and practice. And there still remains plenty of unknowns related to practice. So at this point, just to finish off, I'd like to really re-emphasize the prominence and importance of the coach in all of this and the complexity of their work always, but particularly so in this COVID-19 era. Thanks, Paul.
Thank you, Stephen, and thank you, Gloria, and thank you for everyone that's joined us today. As I mentioned earlier, we've got an opportunity now to ask a few questions. We've got a few already. If you would like to ask one, please use the Q&A function at the bottom of the screen, and we'll get to them. To kick things off, it seems like there's a focus on literature on how coaches need to manage athletes. But is there much literature talking about how coaches themselves are coping through the COVID-19 pandemic?
Yeah, it's definitely an important part because without an athlete, without a coach, athletes and coaches work closely together. One interesting thing that I found throughout my research was there's not a lot on the coach itself. So as you heard through today, there's a lot on how to manage an athlete, how a coach's role is important and vital to an athlete's training and competition and career. There's not very much literature looking at how coaches specifically themselves, how are they coping? How are they managing, juggling up coaching an athlete with their personal life, with the new demands of working with a wider team and new partners in that sense as well. So I think that's definitely an area of research there's not a lot currently out there. So it's definitely worth pursuing more.
In terms of in the presentation, you mentioned the restrictions put in place by the Australian Open. In terms of the big sporting event that's now in 2021, the Olympics, do you feel is there research that suggests that teams coming from countries such as Australia, where the pandemic has had a much smaller impact than, say, for example, a country like England, who have just come out of a 4-week lockdown, is there a suggestion or any research discussing how it might favour one or the other?
So I might have a go to start off with, and then Gloria can fill in some of the gaps. So there doesn't appear to be a strong body of research specifically about that. But what is out there suggests that exactly your point. For those who are less restricted, if they've been able to reduce the amount of detraining and are able to have a prolonged period of return to sport, they're going to be far more advantaged than some countries where the training in open environments, training with coaches, with teammates, and particularly in team sports, are going to be disadvantaged going into the games. There is some evidence about how these postponements have actually helped some athletes, particularly those returning from injury. So there are winners and losers out of a pandemic, and often it is like in a lot of respects to do with performance. It's sometimes about the haves and have-nots. This time, it's not necessarily about money. It's about how the virus has been managed, as well as geographical considerations, like Australia being quite isolated.
Yeah, and just echoing what Stephen said, it seems like there's countries like Australia, they might be at an advantage being able to physically train outside, being able to sort of maintain the same level of intensity and volume of training that athletes have previously been training with. I think it's also interesting to note and maybe monitor how athletes in countries, like you said, England, how they end up faring at a big event like the Olympics, like the biggest event. If quarantine restrictions have actually negatively impacted performance, will be definitely a very interesting thing to monitor.
On a similar vein, when we look at team sports at major competitions, so for example, there's plenty of team sports at the Olympics, anything from a relay team all the way through to a basketball squad. Do you think that we're going to see, or what are your thoughts on whether selection panels will completely change the way they look at their team composition to make sure they've got enough people to cover for those late COVID scratchings? Do you think we're going to see bigger squads, or is that going to expose more risk?
Yeah, so I think the rules will change around that. So often the size of squads that you're able to have and the reasons for which you can bring people in and let people leave are pretty tightly controlled. So I think we'll see some revisions of those rulings worldwide, no matter what competition you're in. The thing that springs to mind for me in team sports at the Olympics is that in a number of different disciplines, these teams don't play together regularly in any case. So being able to manage the individual athletes and who they select might not change all that much. But part of what will be taken into consideration is what has their preparation looked like? Have they been able to have high quality training? Have they been engaged in competition bubbles that have allowed them to practice their craft there? I think those things will come into consideration.
Great, and we've got one other question, which it actually echoes a little bit the very first question, where we talked about looking at the coaches rather than the athletes. But I'll just phrase this one a little bit differently to try and answer the question that's been put forward. It asks, is there any literature that talked about the well-being of coaches? And I guess, and it also talks about support related to COVID-19. Are you aware, or is there an avenue for coaches, particularly elite professional coaches, to access support, whether it be through the Australian Sports Commission or other sorts of things? Does such a thing exist?
From what I'm aware of and from the literature that I've been able to look at, not quite. There's not an extensive body of literature looking at the coaches themselves. But I guess in terms of managing athletes and sort of the psychological side of things, in that they are encouraged to seek psychological support, counselling and well-being coaches. I think it's safe to say that it's safe for coaches to adopt a similar outlook and for similar recommendations to also apply to coaches in that sense, in that they're also in that same high performance elite area. So the stresses on them would be the same, if not more as well. So I think it'd be safe to say that recommendations on the psychological side of things that apply to athletes would also be able to apply to coaches themselves.
And what I'd add to that from a practical side is that the well-being of coaches is on the radar, but that does not mean that there have been great strides made in terms of living the reality of it and providing meaningful and ongoing support. So in lieu of that, what we see is some really good pockets of things being done well, where you've got sports psychologists embedded in programs who are providing support for athletes as well as the coaching staff. We see some places where there's extensive networking and mentoring and other support mechanisms placed around the coach. But then, of course, we see plenty of examples, many quite notable in our professional codes back in Australia, of coaches being completely burnt out and insufficient support to allow them to continue in their work.
That's fantastic. Well, thank you very much, Stephen. Thank you, Gloria, for both of you taking us through this discussion. I know it's certainly something that's going to become very prevalent over the next 12 months as different countries emerge and we hopefully get some of these major sporting events back on track. Thank you to each of you who have joined us today. As I mentioned, this has been recorded and we'll send out the link early next week. But in the meantime, I'd just like to thank you once again, Stephen, and thank you, Gloria. Have a great day.
No worries. Thank you.
Thank you.